Now, here's how it's supposed to work. If you go out for a meal, you are supposed to get a phone call from somebody if it turns out that someone in the restaurant in which you were having a meal tests positive for coronavirus, or COVID-19, as it is called. You are then supposed to inform all the other people who were in your group, because you've only given your name to the restaurant, because the restaurant doesn't know who the rest of the people in your group are. They're now telling us that if that doesn't work properly because you don't answer your phone, they're going to send somebody round to knock on your door to tell you that you have been possibly exposed to COVID-19. We keep hearing all the time from various members of the government and also from various doctors that tracking and testing and tracing is the most important thing to stop the spread of coronavirus. But I'm not entirely certain why, in this country seemingly, they can't get it right. Let's talk to Matthew Lesh from the Adam Smith Institute to find out what he makes of it all. Matthew, very good morning to you. Welcome.
Good morning. Thank you for having me.
Thanks very much indeed. I mean, it doesn't sound to me as though the track and trace system's working very well at the moment. If they try and expand it to knocking on people's doors, that sounds like a bit of a recipe for disaster.
Look, this kind of really goes back to the start of the crisis when we saw the complete and abject failure of public health England when it came to expanding testing and expanding tracing that led to the outbreak in the first place. The government thankfully took control away from PHE for this new testing system, for this new tracing system. But I think a key failure they made, Mike, was the fact that they kept everything quite centralised. So rather than using existing public health officials that are employed by councils all over the country, they decided to set up kind of a national call centre and use a very centralised system of testing at a relatively small number of labs. So I think this is actually better news than it might first sound to some listeners, which is the key change here is rather than just having a very nationalised, a very centralised system run by some outsourcers in the name of Serco, they're reducing that national number of contact tracers from 18,000 down to 12,000, and instead they're going to redeploy the remaining tracers to work with teams in local councils to get down to local outbreaks. So currently there's a big issue that particularly people who give the names of after they test positive of their family who they've been in contact with, about half of those people don't actually pick up the phone call.
Right.
Now, when you get a random number, often you actually don't pick it up, especially from a national number. So the idea is that there'll be more local calling going on, so it comes from a local number, as well as if after a couple of days they haven't been able to get through to you, they may end up knocking on your door in a small number of cases. And this has already been trialled in Luton, in Leicester, places where there have been outbreaks, and it's proven relatively successful to use that local knowledge, use that expertise, and use those people already on the taxpayer dime who are capable of doing this job.
But I thought there was already a problem with the numbers of people who are making the phone calls and that some of them are now being laid off because there's nothing for them to do.
That's absolutely right. So the government surged capacity quite high to begin with in this whole contact tracing system. But it turns out that thankfully there's actually been a bit less COVID than people hoped, and there've been a lot fewer cases that have been needed to be traced. So you've had a lot of people who've been sitting at home watching Netflix and doing exercise classes on YouTube rather than actually doing something. So in a sense, it's welcome news that they're reducing the numbers of people who aren't doing anything, saving the taxpayer a bit of money, but also changing the system around to make it more localized, using the kind of local knowledge that people have in their communities rather than a very centralized Whitehall first approach, which is the current tracing system.
Yes, but I think the problem with going round to people's houses and knocking on the door, I mean, that is a very much more invasive procedure than making a phone call. And I think a lot of people will not react well to it.
Yeah, I think it is invasive, and it's not something that should be done lightly. I would say it is probably best practice. If you think traditionally about public health, it was people going around and knocking on your door and saying that there's an issue with a local water tap and you need to be careful about your hygiene. I think the idea of actually talking to people one-on-one and explaining firsthand what it is and trying to therefore persuade people of the importance of taking the action of isolating. Of course, you're doing that not necessarily for yourself, but to stop spreading to others. And if you can make that case to somebody firsthand, I think it's going to be a lot stronger. And I think it's ultimately less invasive than secondary shutdowns. It's less disruptive than closing down workplaces, less disruptive than shutting down schools again. So to some extent, in the scheme of liberties that we've had to give up in recent history, I don't think it's the worst thing in the universe to have someone knock on your door and talk you through what's going on.
Yes. I mean, the trouble, of course, is that the way that the system is working at the moment is it's not working very well, largely because people are not actually collecting the data in restaurants and in bars. I saw that Luton Council actually put something out the other day in which they said they wanted people to report premises which were not doing the tracking properly. Because most places are saying, look, this is voluntary. If you want to give us your name, you can, but you don't have to.
I think that is a potential big issue. I noticed, you might have noticed as well, that when the lockdown initially withdrew from restaurants and bars, there was a lot of effort to try to take people's names and numbers, and that's kind of disappeared. I don't think anyone's asked me for many weeks for my details when I've gone to a restaurant.
Right.
It is important that people continue to do that, as you're saying, so they can pass that information on to the contact tracers. Another issue we have as well is that we're not sure about the extent of compliance with requests to isolate. We actually don't know whether or not people are doing it properly, or if people are saying, yeah, I'll isolate, and they're not actually doing it.
Right.
And we also have to worry a little bit about what the incentives are here. I think there's a risk that for some people who can work from home, it's fine to isolate for a couple of weeks. But for a lot of people whose livelihoods depend on physically going somewhere to work, at the moment, there's very difficult, just to be able to put food on the table for a lot of people who live paycheck to paycheck. And there's no special kind of payments. In a lot of countries, if we ask people to isolate for the good of the community, we also acknowledge that there's a cost to them. In some places, you'll get your rent paid for a couple of weeks. You'll get your kind of payments to you. So there's also, if we can put stronger incentives to make sure people comply, and make it so that you're not... The other issue as well, I think, is that if you test positive, how many friends do you put in the situation where you ask them to isolate? You're putting your friends into a difficult situation as well, by providing their name. But if you knew that they could get some kind of support to isolate, I think it would be much easier. I think that's really the next step the government has to take, which is considering what kind of incentives there are to encourage people to isolate.
Yeah.
Because at the moment, it's not clear that people necessarily are doing it.
But we're hearing from other countries, Matthew, that the track and trace system works a lot better. Is that just because culturally they're more used to giving their sort of freedoms up?
Potentially. I think there's probably some standard better administration of the systems in a lot of countries, as well as if you look at my home country in Australia, Victoria, if you step out of your home after you've been asked to isolate, you're breaking the law and you can get a £10,000 fine. So in the UK, it's all very kind of relatively weak at the moment, where we're kind of trusting people that they're going to do the right thing. And I hope that's the way the system can continue, that we do trust people. But at the same time, if people aren't doing the right thing, then there might be a need for more draconian steps. Now, I don't think that's something that we should strongly advocate for or think would be a fantastic idea to force people to lock them up in their homes. That said, though, we do it, ironically, we do it for people who arrive from certain countries. So if you come back from Spain, you haven't necessarily been in contact with anyone who's got COVID, but we ask you to isolate for 14 days, and there's criminal penalties and fines if you step out of your home in ways that you're not allowed to. But if we know...
But that's, again, you see, you've had to say that in such a way that it sounds mad, If you step out of your home in ways you're not supposed to, well, hang on, either you're in quarantine or you're not. The fact is, quarantine isn't a quarantine because you're allowed out.
Well, exactly. And even so, if you're asked to quarantine because you've come into contact with someone who has COVID, there's just guidance. It's not actually legally enforceable.
Right.
So we're trusting people, and I think it's good that we're trying to ask for people's trust rather than trying to find them and do police checks. But the issue is that might not be enough, and it might not be effective. So in a lot of other countries, there's just far stronger requirements to isolate than in the UK.
Yes, I think that's true. But the problem here, it seems to me, is that people are not interested in giving their names to restaurants for the very reason that they might be forced to sit inside for 2 weeks, where they may have not even been in any danger or in any contact, because I think the rules basically say that if somebody tests positive for COVID-19, say in a pub, and you happen to have been in a separate area of the pub or even outside the pub, but because you've logged your name with the pub, you get told to self-isolate, it's a kind of a nonsense, isn't it?
Well, I think that's right, and people might be concerned. I think we've got to be as targeted as possible, if possible, to people who physically were around and near that person, as well as people who are kind of in direct contact. There have been some cases where a lot of people in the same kind of physical space, because of the way air can flow around, could potentially come into contact with the virus. But I think you're right that it needs to be targeted. We don't want to unnecessarily ask everyone to isolate because we want people to do it and we want people to take it seriously if they are.
Yeah, I mean, the other problem for people like me is that I basically don't answer my door. You know, if somebody comes and rings my doorbell, I'm not answering it. And I'm in a block of flats. They don't know whether I'm in or not. So they may have little success anyway.
It's possible. It's possible. And of course, the phone call would be the first point of call.
Yeah, I don't answer the phone either.
So, well, you might just be a very hard person to contact for
I am.
tracing.
I am. I spend half the day talking. I don't wish to talk to anybody that I don't know. Thank you very much indeed.
That's fair enough.
Absolutely right. So as far as the invasion of privacy thing goes, I mean, where did they get the right, for example, to come and tell you something in person when you haven't asked them to do that?
Well, I mean, people can knock on your door for all sorts of different reasons, usually selling things that you might not necessarily want. I mean, I think in the
but this has got the kind of overarching aspect of the state attached to it, which makes it a lot more sinister.
Well, absolutely, and it is something that is uncomfortable. It's not something that we want to have to happen. We have to remember that there is a good in, and there is a public interest in ensuring the people who directly come into contact with people who come down with this virus are isolating to stop the spread as much as possible, to stop further disruption and more draconian measures. I mean, I think in the scheme of the things that we've been through in the more recent months, I just don't think knocking on your door is necessarily the biggest infringement on your liberty or your privacy, especially if it's justified, as I think it is, to try to stop this virus from spreading.
Yeah, well, if it's justified, that's the big if, and that is the massive if, which nobody seems to know the answer to. Matthew, thanks very much indeed. Matthew Lesh there saying it's not a massive infringement on your privacy. Well, I think it is, actually. I don't want people knocking on my door, telling me stuff. No, thanks. I like to be left alone. I don't wish to answer the door. I don't wish to have unannounced visitors. It might sound a little bit Victorian, but that's the way it is, and that's the way it goes. And if the phone rings and I don't know who's calling me, I don't answer it either. And if you don't leave a message, I'll never know who you are, and I'll never call you back. Just telling you, in case you need to know. This is Talk Radio.